Have you ever skipped a meal because you weren't hungry and didn't think too much of it? Maybe you're overlooking a serious medical complication. Watch until the end of this video to be sure. Let me ask you first, are you losing your appetite? Do you never feel hungry? If you're worried that your body is wasting away or that you're losing weight and feeling unwell, you should look for other symptoms to see if you have a medical problem. Doing so would allow you to get treated with the right care immediately. You might be able to overcome the challenge and reintroduce those once familiar hunger pangs so that you can get the nutrition that your body requires on a day-to-day basis. Before we go on with the video, a brief request from us though. If you find value in this sort of content, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Here are 10 possible causes why you aren't feeling hungry. First on our list is anxiety. While anxiety can make you lose your appetite, some people actually crave a snack to divert themselves or reduce this anxiety. A lot of people lose their appetite. Additionally, you might feel your heart racing, your breath becoming shallower, your heart palpitating, disoriented, or get the feeling of butterflies in your stomach. How do you cope with this? First, you must seek medical treatment for anxiety or panic disorders from a qualified professional. Next, you should schedule therapy sessions to keep things from getting out of hand. Third, exercise. Exercises that focus on breathing help reduce tension and anxiety. Number 2, depression. Losing your appetite may be followed by feelings of hopelessness, sadness, guilt, low self-esteem, and irritability toward everyone if you are clinically depressed. Along with losing interest in food, you might also start to lose interest in activities you used to enjoy. How do you cope with this? Well, exercise can help both reduce depressive episodes and boost your mood, making you more open to eating. These benefits are in addition to any professional assistance you may receive from therapy and/or medication. Number 3, anemia caused by vitamin B12 deficiency or iron deficiency. Appetite loss can be brought on by inadequate vitamin B12 intake. It can cause confusion, a loss of balance, as well as tingling sensations, depression, or even dementia. So how does one address this? Your doctor might advise taking vitamins or getting a B12 shot. A balanced diet should also contain enough poultry, dairy, seafood, and eggs. Exercise and sleep are also crucial for total healing and recovery. Number 4, thrush. Due to the various symptoms of candidiasis, which is a fungal infection of the mouth, a person's appetite may decline. The most obvious signs are the white plaque patches that develop on the surface of the interior of the mouth. How can you cope with this? First of all, don't merely assume that the infection will disappear. There is a high risk that it will spread to other parts of the body, and that could end up being fatal. Ensure you practice good oral hygiene by always rinsing your mouth well after meals, brushing twice a day, flossing, and having regular dental checkups. Number 5, irritable bowel syndrome. IBS leads to digestive issues including altered bowel habits and discomfort in the abdomen. As a result of gas accumulation and increased flatulence, it is also possible to lose your appetite. How do you address this one? If you make a few lifestyle changes, you should be able to eat. Some of the culprits of IBS include stimulants like cola, tea, or coffee. They stimulate the intestines and should be reduced. Exercising is also a good idea to ease IBS symptoms. Number 6, eating disorders. Anorexia nervosa, also known as anorexia, is a potentially life-threatening eating disorder that is characterized by self-starvation and excessive weight loss. The disorder is diagnosed when a person weighs at least 15% less than their normal or ideal body weight. Extreme weight loss in people with anorexia nervosa can lead to dangerous health problems and even death. Eating a highly calorie-restricted diet, limiting what you eat, exercising too much, using laxatives, and purging your body by inducing vomiting, and even binge eating may be other signs you have an eating disorder. How can you possibly cope with this? Well, cognitive analytic therapy, cognitive behavioral therapy, interpersonal therapy, focal psychodynamic therapy, and family intervention are a few of the major measures that are the usual line of treatment. Number 7, treatment side effects. Cancer is an especially sensitive topic that we here on the channel take seriously. If there are at all any signs that you might see developing on your body, do get yourself checked. Cancer patients may have changes to their senses of taste or smell, which might reduce their appetite. Sometimes, a tumor might develop and affect how hungry you feel. How can someone possibly deal with something like this? Try not to eat large meals. Instead, eat numerous small meals throughout the day and make sure that food that you consume has a high calorie count so that it is both calorie rich and nutrient dense. Number 8. HIV or human immunodeficiency virus. HIV might result in weight loss due to appetite loss. Due to opportunistic infections like candidiasis and cryptosporidiosis, you might not feel hungry. These infections frequently take advantage of your body's weak defenses against assault. How do you cope with this? You might need to consume high-calorie, high-protein meals to keep all of your muscles from wasting away. Be sure to include foods like cheese, eggs, peanut butter, and other staples. Additionally, to prevent muscle wasting, engage in some strength training activities like light weightlifting or resistance training. Number 9. Liver problems and jaundice. Loss of appetite, nausea, diarrhea, and progressive fatigue are symptoms of liver disease and early-stage liver failure. Additionally, you might experience confusion, disorientation, or extreme sleepiness. Cirrhosis symptoms include hepatitis, chronic liver illness, or liver issues that have an equivalent impact on appetite. They also include easy bruising, frequent bleeding, jaundice, yellow eyes and skin, water retention in the abdomen and legs, toxic accumulation, and itchy skin. Some ways to remedy this includes avoiding consuming alcohol for a few weeks if your liver issues are caused by either fatty liver disease or alcohol abuse. Afterwards, only consume alcohol in accordance with recommendations. Your appetite may return to normal after treatment when other symptoms subside. Number 10. Medications and their side effects. Loss of appetite can be a side effect of some medications. You might not be particularly hungry or even want to eat anything. These pharmaceuticals include antibiotics, morphine, codeine, and chemotherapy drugs. Furthermore, using narcotics like heroin, cocaine, or amphetamines could result in you losing your appetite. If you're unable to take any alternative treatments, you will need to learn to simply eat because you have to. However, if you abuse street drugs, there are numerous reasons to try and stop for your health and obtain professional help if you need it. So that was 10 reasons why you may have lost your appetite. I hope you found this video both enjoyable and informative. Of course, if you have any queries and questions that you want to be answered, let me know in the comment section below. Also, be reminded that this video is primarily for information only and we do not claim to provide medical advice that is tailor-suited to your needs. Be sure to consult with a medical professional and seek personalized healthcare that will fit you. Post in the comment section below what health topics you would like to see in our next video. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later and thank you as always for watching.